What health disparities are we seeing in American society today?
We see health disparities that are large and persistent. I will talk specifically about racial ethnic disparities because there are also disparities by socioeconomic status, by income, education, occupational status. So, for example, the average African American in 2020 would live 6 years shorter life expectancy than the average white person. There was an 8-year gap in 1950. Just an example of both groups have experienced increases in life expectancy over time, but we still see a gap persistent. COVID-19 has made health disparities much worse. All populations of color, Native Hawaiians and Pacific Islanders, Native Americans, Latinos, and African Americans all had death rates, age-adjusted death rates for COVID-19 that were more than twice that of whites in the United States. And as a result of COVID, life expectancy in the United States declined, a large decline. We have not seen such a decline as occurred from 2019 to 2020 since 1944. And it has widened the gaps between blacks and whites and other groups because Hispanic and African American males had a life expectancy decline by at least 3 years from 2019 to 2020. Females, Latino and African American, decline of 2 years, more than 2 years. White males and females of more than 1 year. So all groups decline, but you can see the disproportionate negative impact. I could go on and on. Let me give you one last example of a disparity that for me is one of the most troubling that I have seen in recent years. A group of researchers looked at suicide rates among elementary school children 5 to 11 in the United States, looking from about 1990 to 2014. And what this found was the suicide rates were stable. They had not changed overall in the US. However, when they broke down the data by race, what they found that the rates were stable for Asian and Latino children. The rates had markedly declined for white children. The rates had doubled for African American children. A follow-up to that study found the pattern exists all the way through 2013, and African American boys and girls in the United States have twice as likely than their white counterparts to commit suicide. For me, I try to remember, and I don't know that when I was in elementary school, I knew what suicide was. So to think that African Americans, children, are committing suicide at such a high rate is troubling. And for us, it raises the question, what does it mean to be a black child growing up in America? A study published just last year that looked at almost 10,000 children, a little older teens, and looked at the higher rates of suicide among African American teens and tried to identify what might be the contributors to that. They found it was experiences of discrimination. In fact, statistically, when they added discrimination to model, there was no racial difference. In other words, the racial difference is completely driven by higher levels of discrimination for African American children and youth in the United States. Importantly, the pattern of health disparities for African Americans does not exist just for one or two outcomes. For virtually all of the major leading causes of death, for heart disease, for cancer, for stroke, for diabetes, for hypertension, and the risk factors like obesity and so on, we see the pattern. So it's a pervasive pattern across a broad range of outcomes where multiple different risk factors are operative in producing these results.